Bleeding gums are not normal. Hey everyone, it's Joyce the Dentist. Have you ever noticed pink in the sink when you're brushing your teeth? Maybe you've even totally given up on flossing because every time you floss your teeth, it just makes your gums bleed. I know what you're thinking. There's no way I'm going to keep doing this to myself if I'm just going to keep bleeding every time. But the fact of the matter is that sometimes it takes repeatedly cleaning your teeth and gum lines to get the bleeding to stop. Other times it requires professional treatments or even laser therapy. First, let's talk about why gums bleed and what makes them bleed. Gums bleed because of a natural immune response to bacteria. When bacterial plaque rests next to your gums, your body starts to say, hey, why are there germs hanging out there? It would be the same thing if you had a little scratch on your skin with dirt in it, assuming you didn't clean it after a few days. Slowly but surely, your body starts to send antibodies to that space. And what do we get? Gums that are swollen. Wait a little longer and the tissues thin out so that the antibodies can get through your gums directly to where the bacteria is at. Once that happens, you see bleeding. Your body is just doing what it's supposed to when there's an infection. If there was an infection anywhere else in your body, you'd probably be doing something about it. But for some reason, when it's bleeding gums, people tend to not feel as concerned. Bleeding gums is your first sign that you need to do something. But let's just say that, like other people, you don't. If the bacteria set there, and they'll calcify over time if they do, you gradually get bacteria deposits that turn into icebergs, where the bacterial colonies are deep under your gums, even though you don't see them. As that happens, more antibodies rush in and more tissue is destroyed. Slowly but surely, your gums pull away from the tooth, which causes the bone underneath them to dissolve. At that same time, deep pockets form around the roots of your teeth, which then harbors even more bacteria. As you can see, you've got to get a grip on it really fast. If you don't, bleeding gums can eventually lead to tooth loss. Now, on to my second point. Is it possible to get your gums to stop bleeding without seeing a dentist? If you have gingivitis, yes. Most cases of gingivitis are totally reversible if you're flossing and brushing thoroughly every single day. It usually takes about 2 weeks to get the bleeding to reverse. Keep in mind that most of the bacteria that cause bleeding gums are right under the edges of your gum tissue or between your teeth. An electric toothbrush can be extremely helpful since it helps stimulate the gums and oxygenate the tissue in those spaces. But even if you're brushing really well every day, you still need to be flossing or using a water flosser to clean all of those other spaces that the toothbrush doesn't necessarily reach. And here's the kicker. If your gums keep bleeding after religiously flossing your teeth every day for 2 weeks, you probably have a more aggressive gum infection known as periodontal disease. Unfortunately, you can't reverse periodontitis or treat it on your own. At that point, you have to see a dentist before you risk losing your teeth altogether. Thirdly, what type of dental treatments can your dentist perform to get your gums to stop bleeding? More than likely, your dentist and dental hygienist are going to team together to 1. Discuss your oral hygiene routine. They may have some suggestions for your specific brushing and flossing methods that will be helpful. 2. They'll probably recommend a deep cleaning. This procedure removes all of the calcified bacteria under your gums, the ones that are responsible for triggering the chronic bleeding and gum infection. During your deep cleanings, the hygienist will use special instruments to remove the bacteria under your gums against the roots of your teeth. 3. They may also use a soft tissue laser to destroy the dying tissues without harming the healthy ones. Soft tissue laser therapy jumpstarts the healing process and helps your gums bounce back more quickly after periodontal therapy. And 4. Finally, your dentist may prescribe a mouth rinse or medication to take after your deep cleaning. This could also include a small antibiotic capsule placed under your gums in the more severe areas of infection. All of that being said, if your gums are still bleeding after daily flossing and gentle brushing for at least 2 weeks, it's time to call a dentist. And oftentimes, if your in-office treatments do not yield better results, your dentist may refer you to a periodontist. Remember, your smile isn't the only thing at risk. Active gum disease can also raise your risk of cardiovascular diseases, pneumonia, and infertility, regardless of your gender, plus a lot of other conditions. So call your dentist today and have them take a look at your gums for periodontal screening. And if you like this video, hit the thumbs up and check out this video next.